So the really cool thing, and I love the vision that the Chamber has for this, because it really was always our pipe dream to do something like this.
Welcome to The Talk Chamber, a production of the Greater Memphis Chamber. The Talk Chamber is the podcast for the latest on the Chamber, economic development, and all things Memphis. This mic is powered by Ortho South, world-class orthopedic care all across the Mid-South. Today's episode features Raegan Le Douaron, the CEO and owner of We Care TLC. Raegan,
Yes.
Thank you for coming on.
Thank you for saying my last name.
Listen, I tried real hard, as you know, and may
You did
not
great.
be perfect.
No,
but
I don't even say it correctly, so that's good.
is it the thought that counts?
It is the thought that counts. It's the effort.
So tell us about yourself and We Care TLC. What is it?
So We Care TLC implements and manages primary care health centers for employers. We've been in business for 21 years. We're a second-generation family-owned company, and I'm the second generation of that family. We're a Tennessee women-owned business, and so we're partnered with the Greater Memphis Chamber to do ChamberCare. So we're the provider that manages the clinics behind ChamberCare.
Awesome.
Yeah.
And what is ChamberCare for people who may not know?
So ChamberCare is a benefit for Chamber members that they can purchase, and it's basically purchasing access to primary care as a health benefit for their employees. So and their family members are also included in that. So for $40 per employee per month, an employer can purchase primary care access for their employees and their family. Traditionally, we partner with larger employers, and they typically will partner with us as a proactive health plan savings strategy to bring down their overall cost of care by investing in primary care. And so we can still do that through ChamberCare for the larger employers in the area. But the big benefit that the Chamber has always been very passionate about is also offering it to smaller employers who may not be able to afford or they may not be able to offer health benefits for their employees. So this gives them an opportunity at an affordable price to give their employees a great health benefit.
Raegan, you mentioned $40 for the employee.
Per employee per month.
What does that include? So
that includes primary care, unlimited primary care access for the employee and for all of the members in their household.
So that would be husbands, wives, children.
Mm-hmm. Yep.
However many that is.
Correct. Yeah, as long as you live in the same house, then you're eligible to go to the health center. So I know parents really love that because especially when they're very young, kids get sick a lot. And so it's a very quick and easy way to, bring them in and to just kind of get in and get out and maybe get the medication that they need right there. And so I know, especially here locally, I've heard a lot from parents expressing how valuable that is.
So when you say primary care, is it a real primary care, the full shebang, or is it an urgent care, come in when you're sick, come in when you need somebody to look at something?
Yeah, so we're available for both. We are certainly available for same day, next day appointments for those urgent care acute needs, so sinus infections or flu or strep, but we are very much focused on the preventative aspects. So, if you come in for an urgent care visit and you'll be speaking with the doctor or nurse practitioner or even the MAs, the medical assistants in the health center, they'll ask you, have you had your yearly physical? And most oftentimes the answer is no.
Right.
And so they'll suggest creating an appointment after your urgent care need and to come back. And that's what we really are there to do, is not just treat the urgent needs, even though those are important because we need to take care of them before they, get to be something bigger. but we're there to truly improve people's lives overall. So that's what we're focused on. And so we have coaching on different disease states. So, if you are a person that has a diagnosis of prediabetes or diabetes or hypertension, our team is there to help work with you and provide the education and support that you need to make improvements in your overall health.
And these are doctors and nurses. They've gone through med school.
Correct. Yep.
They are the real deal.
We only hire quality people. And it's really not just about their education and background, although that is very important.
Right.
But equally as important is their mission to make an improvement in people's lives. And as caregivers, just because of the current state of healthcare, most clinicians feel like they're kind of on a hamster wheel and, with claims and coding things in the EMR and trying to get through a lot of patients in one day. They love practicing in our health centers because they get to spend time with the patients. So typically your first visit, now if you're coming in for an urgent care, that probably won't be a very long visit, but your first real true visit at the health center will be about 40 minutes. And that's not 40 minutes in the waiting room, a few minutes with the nurse practitioner or the doctor. That is coming in, being greeted, because you'll always have the same care team. You'll get to know the care team. They get to know you and your family. And you're brought to the back. And, after your vitals are taken, the nurse practitioner or the doctor comes in and spend time with you and get, you go through your current health issues if you have any, and then they start digging behind, maybe, okay, hypertension, let's talk about anything else you have going on, your stress level, what's going on at home, so they can get the overall picture of you and really, truly, holistically make improvements over time.
This sounds like a really awesome benefit, because what I'm hearing is intentional care from doctors who care.
Yes, and from the whole care team too, because our nurses are very important in our care team, and they're the ones who are I always call them the verb of doctors are very great at telling you what to do and what they want you to do, but they don't typically enjoy the hand-holding and the education and all of that like the nurses do. And so I always say the nurses are the verb of the care. They're the action behind the care plan. They're there to, if somebody comes in, let's say, who has a diagnosis of diabetes or they're pre-diabetic and they take an A1C and they're like, why is my A1C so high? My blood sugar was really good yesterday. And the nurse is like, well, A1C is about what you've been doing the past 3 months. Blood sugar is about just what you've done, in the past few hours. So let's start talking about what you've done in the past 3 months and start working on that. And then, maybe keeping a food diary and along with your blood sugar, and sending it on a weekly basis to the nurse, and they'll just continuously engage with you. So you learn more because as people, we've become really disconnected, especially from primary care, because there's just a shortage of it regardless, anywhere you go in whatever community you're in the U.S. So people are a little bit disconnected from how healthcare should be. But this is truly just taking it back to, maybe in our grandparents' days where they've had their family doctor, forever.
Right.
So they grow old together. But in this case, we're really just setting that. And I think, in Memphis, it's been just really great to see this come to life and to see the response that they get to people the clinicians who truly just spend time and reach out to them. Like if you come in for a visit or they have to refer you to another doctor, they reach out and they, follow up with you or they ask how you're doing. And, just people aren't used to that anymore.
No, that's not, typically what you get in today's world. So I'm thinking about people, who might have be seeing their primary care physician for prescriptions and
Yes.
getting prescriptions. Is that something y'all do too, or is that going to be need to be somebody else?
No, so if you're a doctor or nurse practitioner, you could prescribe. We also have a dispensary in the health center, so
Okay.
and lab services that we do in the health center. So we partner. We have a national partnership with a wholesaler, so we cut out several layers of the supply chain for medications. So we acquire our medications at a much lower rate than people get them through the health plan. And so how it works is that if somebody's on a prescription, and we tend to get a lot of people at first when they hear, you can work things a few different ways in the ChamberCare program. So for those people who have a health plan already and they're using us to be a proactive savings measure, they will pay for the labs and the medications in addition to the access to the primary care because they're saving money on that but through us rather than paying for it through their health plan. The employers that don't offer a health plan and who are just participating in ChamberCare, they can opt to not pay for the labs and the medications, but we just pass on that savings directly to the patient. So, for example, a statin through the health plan can cost, it does cost over $100 a month, right? And part of that, may be a $25 copay that the patient has to pay, and then the health plan pays for the rest of it. In our health center, that same drug is $9.
Wow.
So
That's a big difference.
It's a big difference. So, and you get it right there. So it's not like you have to go down to the local pharmacy and pick it up at another time. You go in, the doctor writes your prescription, and if it's carried on the formulary, then we dispense that right there, and then you can leave. The same with labs. You can come in the morning on your way to work, get your labs. You'll have your results, and your clinicians will follow up with you in the next day or two, and it's all easy and convenient. So
that's really awesome because it takes a few extra steps for the consumer, for the patient.
Yes.
Takes that out and makes healthcare easier.
Exactly. Well, that's what we want, right? And that's what it should be. It shouldn't be complicated. Anytime you introduce either a cost factor or an inconvenience factor, the adherence to the care plan or what should be happening in that person's health journey, it tends to not happen that way. And we are all busy. I mean, I'm just as guilty of it as anybody else. If, let's say I have a full day at work, if I had to go pick up the kids, I may not be able to go get labs done, whenever they have availability for me. And so that's why your initial question, what is the health center? Is it urgent care? Is it full primary care? We want it to be everything. We want it to be, if you need something as it relates to your health, we just want you to go and we'll take care of you, because we don't want any kind of barrier presenting itself on people getting healthy. So we take a lot of pride in, really giving that extra level of patient service, that customer service that, it might be hard to find.
I love that. It's very nurturing.
Mm-hmm.
It's very intentional. I've already said it, but it's, it's personalized, and it makes getting healthy and staying healthy easier, which I know for a lot of people can be a struggle for whatever barrier they have, whether it's time, money.
Yeah, and convenience. And so, and a lot of it's the knowledge, right? So
Definitely.
the healthcare has just become so fragmented that we've gotten used to managing our own health, and there's very few people who are qualified to do that.
We're not the doctors that went to the med school and that are certified, know the knowledge, know how to do it.
Exactly. So we want you to participate in your healthcare, but we want to be there and help advocate for you as, a human being and help guide you along the way. So And, if you look at that as an employer, right, and everybody's focused on culture, everybody's focused on engagement. Those are much talked about subjects. And
Yes.
so this is a truly valuable way to create a culture where the employee knows that this nurturing environment is provided by their employer. And I was just speaking with somebody who I was telling them that for me, I feel very lucky to do what I get to do because it's a true win-win. So for patients, they get such a high level of service that it creates truly a loyalty to the clinicians, the healthcare team, and to their employer. And then for the employer, we're adding a valuable health benefit to their arsenal of things that they invest in to attract and retain their talent, and to, if they're providing healthcare, to keeping that cost low, and so they can continue to offer that benefit over the long haul. And so it's really great to be able to do that. And I was telling somebody on a recent call that we are in 15 different states. We have lots of different employer clients across all sectors of the market. And there has never been a time where I have not gone into one of our health centers, and if a patient knows that I'm from our home office, they always come up to me and they say, "This care team is amazing. They've saved my life." There's never been a time that I have not gone to a health center and not heard that. And that, it gives me goosebumps still. I've been working for We Care for almost 20 years.
That's so
and
heartwarming.
It still gives me goosebumps because being able to make that impact is just remarkable, and to, for the patient, but then also to really be a win for our clients and to be able to help them out in their businesses. I think it's pretty cool.
When I think about it from a employer standpoint, I want my workers, my people, my employees to be happy and to be healthy, because there are studies out there that show happy, healthy employees do good work.
Yes, do better work, and for over longer periods of time, right? And you talk about all the different generations, right? And this is huge with HR people because now we're at a time where we're managing a lot of different generations who are reacting to things in completely different ways, right? And how do we engage them, and how do we manage to each of those
different needs?
Yes, exactly, and expectations of the job, and that is a tall order for employers. And I say that being an employer myself, but I know I've just seen it across the board for a very long period of time. Something like this just checks all the boxes across all the generations. And that's also something that's really unique about what we do, because taking it back to that family doctor way of doing things, there's long-term relationships there, right? And so you see people as you age, right? You have different health needs. And so we're there for each of those milestones or times in your life. And so we have one client who we've had for all but one of the years that we've been founded. So they've been around for 20 years. And it's in a rural area in the Midwest. And it's a shared site clinic, so something kind of similar, not on as large of a scale as ChamberCare, but so there's a county government and a school that participates in this health center, and there's been patients who have said, "I've never gotten care anywhere else but a We Care health center, because I grew up, my parents worked for the county, and I grew up coming here. And then now I work for the schools, and I still come here, and my kids go here." And that's something.
3 generations.
Yeah, that's so cool. Like that, who gets to do that?
That's awesome. Let's bring it back in locally and talk about ChamberCare a little bit more.
Yeah.
So how many centers do we have? Where can we find them? How can an employer get involved?
Sure. So the really cool thing, and I love the vision that the chamber has for this, because it really was always our pipe dream to do something like this on a real community. Some people may have heard the term population health. Well, this is truly where we are scaling it to be able to make a true impact on the population's health here in Memphis. And so, one of the unique things that happened along the way is that we're partnered with the Mid-South YMCA, and we are growing into each of their locations around the greater Memphis area. They had a need to partner with us for primary care services, and they also happen to be strategically located where a lot of people in the greater Memphis are. And so it was kind of a natural and great partnership. So we are currently at the downtown Fogelman YMCA, and then this summer, when the new construction is finished at the Whitehaven YMCA, where that's going to be our second location, and then we have our third location that will be coming shortly afterwards. So
plans to expand. That
Yes.
is very exciting. And if I'm an employer and I'm hearing this, how can I get involved?
Sure. Well, they can reach out to their membership sales team through the chamber, or Quentin Robinson and Ted Ferris are the contacts in the chamber, the main contacts for ChamberCare.
I'm an employee and I'm hearing this episode and I'm thinking this sounds like something that the company I work for would really benefit from or really love. What are my steps as an employee to getting my employer in touch with you or whomever?
If you're an employee who has an HR or benefits team, I would certainly go to them and explain what you heard and refer them to this podcast. Maybe they'll listen, and tell them about it. And or if you don't, anyone in your organization who makes decisions, tell them. And I know employers have your contact at the chamber, so just tell them to get in contact with either their membership sales team or Quentin or Ted. We'll be happy to speak with them about it.
Yeah, that's awesome. And our time is almost up.
Oh, no.
But I have one last question. I really just want you to sum up why this matters before we go. And just tell us in a quick sentence or two why ChamberCare is important.
Well, ChamberCare is important because it improves the quality of lives of employees, and it is a great health benefit for employers for retaining employees, attracting employees, and when making sure that if you do have a health plan, that those employees or health plan members are very healthy and happy and productive.
Thank you so much, Raegan, for coming on the show today.
You're welcome. Thank you for having me.
Thank you so much for listening to this episode of The Talk Chamber. We are so glad you're here with us. Raegan shared with us about the ChamberCare centers and how it benefits both employees and employers alike. If you'd like to learn more about the ChamberCare centers, you can visit our website at memphischamber.com. If you enjoyed this episode or learned a valuable piece of information, share this episode with a friend or maybe even a colleague. Subscribe to the Talk Chamber to keep up with the latest on the chamber, economic development, and all things Memphis. Follow us on social media at Memphis Chamber, and we'll see you next time.